Hey guys, welcome to Proof Weight Loss Surgery Works. I'm your Saturday vlogger, Kim, and this week's topic is about your surgeon, or what qualities are good about our own surgeon. Will we pick the same surgeon if we were to do it again? And being that I had lap band surgery, what's really important is aftercare more than anything. So pretty much having surgery, from what I understand and talking to other doctors, the actual procedure and putting the lap band in itself is relatively easy, but I would say obviously you want to look for a surgeon who has done a lot of lap bands, who has a lot of experience with it nonetheless. But where after you have the lap band in, you obviously need to get fills in order to get that restriction level. And fills are where it's at. So really, you need a place. Obviously, the thing is, I live in northern Canada. I don't live in a major Canadian city. I went to Toronto and had my lap band there at Slim Band. They have advertisements all over the internet, but basically why I chose Slim Band is it seemed like they were pretty much the busiest Canadian lap band place I could find. They do the volume of lap bands that they do is so the surgeon, Dr. Yao, has a lot of experience, and I could afford. They had a financing plan that worked for me, and they have fill doctors throughout Canada that they use, and the closest one to me is in Edmonton, so that's about a 5-hour drive away. So for me particularly, where I don't live in a major city, I don't actually have a family doctor, it's tough. I mean, I would prefer to have a surgeon that I'm in the same city as, but unfortunately that's not possible for me, and I'd like to have a fill doctor closer to me, but I don't, and I don't think that there is one available. So, yeah, being that I'm so far away from everything, the onus is on me to take a greater responsibility if I think that something's wrong, to go get checked out or go to Edmonton, make arrangements, travel arrangements to get fills, defills. So, what I do is I call Toronto, set things up with them there, and fax them some forms, and they've been pretty good in terms of answering my questions, but just logistically wise, I mean, I would still pick them because really I don't have a closer option, and if I did have really a closer option, they probably don't have as much experience with the lap band. But the big thing with your lap band is aftercare. Now, on YouTube there are a lot of people, well, just generally speaking, the world of doctors, I work in healthcare, I work with doctors, so some doctors are fabulous, some doctors are not so fabulous, and some people are people persons and some surgeons aren't. They're cut, they go in, they do, but they're not good at talking and dealing with patients. For me personally, you know, I just met my surgeon briefly. I deal with his staff in terms of my aftercare, but for me, you know, you do need somebody who's listening to your concerns. There's a lot of people that I've seen on YouTube that have complaints about their doctor. Obviously, you know, if they're not listening to you, dealing with your concerns appropriately, that's a problem, and you need to find another doctor. But sometimes I think maybe that the doctor is kind of tough love and telling a patient something that they should hear but probably don't want to, and get kind of upset with that. I think that's not the majority of the cases. I think that's not as often, but I think some people do get upset with some doctors because they're told, you know, they're not doing enough. But anyway, that was just kind of some thoughts on it for the time being. Sorry, I look like hell. I'm going to work out in a few minutes. But anyway, you guys take care. I'll talk to you guys next week. Bye.